right, thank you, Alex. So as Alex and Sophia have mentioned, we're very fortunate here at Scottish Rite and in our lab to have a lot of really good high-tech equipment that we're able to use to assess athletes. However, not everybody has access to that. So today I'm going to be presenting a project that we are involved in with some other sites, looking at how do we take this technology out into the community. So I'm going to be presenting a project we're working on looking at injury risk factor prevalence and validating a two-dimensional movement screen. So just briefly, looking at high school athletes, knee injuries are one of the most common injuries that they are experiencing. Around 15% of all high school sport injuries. Of those, ACL rates are increasing. So we all know that. The rate has doubled in adolescents over the last 2 decades, and female athletes specifically are being impacted at a greater rate. They are experiencing these injuries at a rate of 4 to 6 times what their male counterparts are. So kind of because of this, there's a lot of injury prevention programs that are being developed to help improve an athlete's neuromuscular control, to help them modify their landing mechanics, to hopefully prevent these injuries from ever happening in healthy athletes and keep them playing the sports that they enjoy. There are some low-cost screening tools that can be used out in the community that will help proactively identify these injury risk factors. One of these tools is using a visual or 2D assessment that can be used on a very large scale and gives the athlete or the coach or whoever immediate feedback on their risk. So this picture is an event that we were invited to participate in where we're testing volleyball athletes. And as you can see, they're all lined up in front of a video camera, so that's all it's using. And your only limitation is your equipment. So you can test as many athletes as you have video cameras, and they're all lined up performing this screening at the same time. So over a day or a weekend, you can test hundreds of athletes at one time. However, the reliability and accuracy of these screenings is varied in the literature. So as a result, through PRISM, we are part of the Injury Prevention Research Interest Group, and through that group of collaborators that you can see on the screen, we have a project looking at injury risk factor prevalence, and we want to establish what is the prevalence of common injury risk factors, specifically in volleyball athletes. As a group, that was kind of the main sport we had access to when we began this project, but through our SAFE program that Sophia mentioned before, we've had opportunities to expand into other sports. So we did travel to Indianapolis and tested some volleyball athletes, later went to Omaha, tested some more volleyball athletes at the AVCA convention. Through our partnerships locally with the Mavs Academy and some local high school basketball teams, we've now done these screenings in basketball athletes. And then we were fortunate enough to be invited to Orlando to the YS Olympic Development Program, and we tested hundreds of really good soccer players there. So in all these athletes, we're doing this youth athlete risk profile that we've talked about in the other presentations. For the 2D screening, we are using 2D video instead of 3D motion capture, okay? So if this is an option when you don't have a motion capture light, you go to the community, to an event, and just do video analysis. For this profile, they're gonna do a 3-task movement screen. So the 3 tasks that the group is having athletes do includes a single leg squat. So basically just squat down as low as you can, come back up. A single leg drop landing. So this is in the picture, you start on top of a platform, jump down and land on one leg. Both of those tasks are then repeated on the other leg, so we're getting both limbs. And then lastly, a double leg vertical jump, which is basically just a counter movement jump. You prepare to jump, squat down, jump up as high as you can and land. But that task we're kind of able to learn at both the loading phase of that jump and then the landing back down. And then subsequently, like we've done for your FAST projects and SAFE projects, we are doing injury surveillance on any of these athletes that we test at these events. So we will follow up with them if we haven't already, get their injury surveillance, and hopefully create these kind of groups or cohorts of injured players versus non-injured players, and do they exhibit certain movement patterns with this screen that maybe a non-injured player doesn't. So all you need to complete this screen is a single video camera. When we go, we use iPads and we put them on a tripod. They perform the tasks. So here he's performing the single leg drop landing. Face the camera, do the task, have them get back on the box, face the side. using the same camera, you're able to now get the side view. So once we've got the video, what we do next is we take all that video data and we do an assessment. So as a group, we sat down and came up with our rationale for assessing the risk. So one common risk factor is dynamic knee valgus. It's illustrated here in this picture. So it's just this concept that it's not just the medial displacement of the knee in the coronal plane. It's a combination of factors that's leading to knee injury. So when you're landing or you're cutting, your femur goes into adduction, your knee does have some abduction, ankle is everted, there are some rotational components as well. So combining that dynamic knee valgus risk along with some poor trunk control, we believe as a group lead to a lot of our sport-related lower extremity injuries. So from these videos, we go through and score these risk factors as either present or absent at all of these tasks. The first risk factor is poor knee position. So based on the definition we've developed of what that is, we will look at the videos for each task and score it as either present or absent during different phases of interest. We then will shift up to the trunk again from the front view and look at their lateral or side-to-side trunk control. So as they're squatting or jumping or landing, are they able to control their trunk or are they leaning from one side to the other? And then lastly, we look at trunk tilt. So when they're landing or squatting, are they bending over excessively? Are they too upright? That is the last risk factor that we will score as either present or absent. So last summer, we did our kind of first analysis of this screening. We published a paper last June looking at a small cohort of athletes. It was volleyball athletes that we had come into the lab. So we have this screening, but we need to say, is it valid? So in order to validate that, we had them do this three-task movement screen in the lab where we could capture 3D motion capture simultaneously with the 2D video. And then the goal is to say, do the two agree? So can we say it's a valid screen? So in this group of athletes that we had come in, we were able to successfully say that our trunk scoring, so whether the trunk side-to-side lean or forward flexion, those two risk factors did successfully agree with our 3D motion capture data. So that was validated. However, when we looked at our poor knee position risk factor, those did not agree very well. So we sat down as a group and came up with some other definitions that could be used to visually score knee valgus. These are other common methods that have been found in the literature. So we went back in all these athletes and rescored their knee valgus according to the 2D video and compared it to the 3D to see if one of these methods was maybe a better definition to use for this poor knee position risk factor. This should be published soon, but out of that data, we were able to successfully say that there was one visual definition that agreed with our 3D data. We refer to it as our medial definition. And basically, it's just looking at the center of the knee joint as they load, so as they're either squatting or landing, and the position down vertically to the shoe. So you can see in the red image, the knee joint is going inside the medial border of the shoe, hence why we call it the medial version. So from these two papers, we now have a validated two-dimensional risk screen. We have our trunk definitions from that first paper that was published, and now with this follow-up paper, we have a knee definition that has been validated. So we're really excited about that. The next step with this screening is we have these thousands of videos, and a lot of people might be familiar with Dartfish or other similar programs. It's a hybrid approach, kind of between the 3D and 2D worlds, where you're able to take a still image from a video and select certain points on their bony landmarks according to some specific definitions, but then the program will give you some angles back. So two-dimensional angles instead of just relying on your eyes and saying, is that knee inside the shoe? The program will actually pop out some information for you. So similar to the 2D assessments, you're still able to use these on a large scale. You're still collecting videos similar how you did in the other large scale collection events. However, as you can imagine, there is some processing time, so the feedback takes a little bit longer to get this information back to the athlete or coach. But similar to our other study, the reliability and accuracy isn't really known. So that's kind of where we are today. We're going to use this program that we've developed in the lab to score some of those videos that we have, and first see if it's valid, so compare it back to our 3D data, but then also on a larger scale, The whole goal of this project with the other collaborating sites was to look at prevalence. So we're going to go through thousands of videos with the help of our lovely lab staff and see across different sports or genders, are certain risk factors more prevalent in certain sports, or any kind of, if we have enough athletes that we can subdivide. So we're really excited about this kind of next step of the project, and I believe that will wrap up my portion.